Hi and welcome to another educational episode on Physio Ed. My name is Alex Goldenring. I'm a doctor of physical therapy, and today's program is going to focus on a particular neck pathology called cervical stenosis. Now, there's different types of cervical stenosis, and today's episode is going to focus on the unilateral version, meaning one-sided. And in this particular issue, what happens is the space between the vertebrae and the neck closes down. We call that foraminal narrowing. And when the vertebrae come together, that pinches on the peripheral nerve that exits in the neck, and that causes symptoms into one of the upper extremities. And this impacts older adults because of degenerative processes in the neck cause that space to close. So I'm going to walk you through 3 different concepts and exercises to help treat this condition. So let's get into it. The first concept we need to go over is regarding cervical posture. What can happen as we age is our heads tend to come forward like this. And that's a result of being under gravity for a long period of time. And the reason why that's a problem is twofold. One is when the neck is forward like this, that causes the muscles in the back of the neck to have to work extra hard to hold the head up. An average adult human head weighs around 20 pounds or so. And by having the head forward, that relative weight of the head goes way up. So if you think about it, if I hold a 10-pound weight out like this, versus a 10-pound weight like this, intuitively, which one's going to be easier to hold, right? It's obviously going to be this one. If the same weight is farther out, these muscles in my shoulder have to work that much harder. So you apply that principle to the neck. When the head is forward, it's basically mimicking holding a weight out like this for the shoulder. So these muscles in the neck have to work hard and they can get irritated. In the context of cervical stenosis, what can happen when the head's forward is it actually causes the vertebrae in the neck to close a little bit more, and that can cause impingement on the nerve. So we want to work to optimize our cervical posture in order to create more space where the nerve is exiting so it can heal and there can be less symptoms. This is called a chin tuck exercise. What you're going to do is you're going to push back gently like this until you feel a gentle stretch in the back of your neck. And you're going to hold that for about 15 to 20 seconds. And just hold that position. After 15 or 20 seconds, you're then going to release your hand pressure and you're just going to hold that new position in your neck. And when you do this correctly, you should feel stretching in the back and a little bit of activation of the muscles in the front of your neck here. You may even see a little bit of skin creasing underneath your chin, and that's a really good sign. And then you just hold that for 15 or 20 seconds. The goal is to ultimately be able to hold that for a minute, 5 minutes, 10 minutes. But over the course of the day, you can work into holding that position for longer periods of time. The second concept that I'm going to go over with you is actually in the form of an exercise. And this exercise is going to stretch a particular muscle in the neck called the levator scap. And this muscle can get irritated when the head is forward. You're going to put your hand behind your back like this. And then with your opposing hand, you're going to place it behind your head as such. And what you're going to do is you're going to lightly pull to the side, and then you're going to rotate down. In this case, I'm looking towards my left foot. And I'd recommend holding that for 30 seconds to a minute. And when you do that correctly, you should feel a stretch in the back of your neck. So this is addressing actually 2 things. It's stretching the muscle that can get irritated with the forward head posture. And the second thing it's doing is that it's also maximally opening. If I have a right-sided cervical stenosis problem, remember, treatment for this is general to open up that side of the neck. So by stretching into what we call flexion and then a rotation plus a side bend, you're maximally opening the right-sided vertebrae where the nerve is exiting. And that should offload that nerve and create some relief. So let's go over the third exercise, which is cervical traction. And remember, with cervical stenosis, in the lateral version where the vertebrae are closing down on the nerve exiting, we want to create space and open up that area so the nerve can heal and the nerve isn't impinged in that situation. So here's one of the best ways that you can do that at home, and it's called cervical traction. Let me show you how to do it. I'm in a kneeling position, but if you have a counter that's higher up, you can do this in standing because for a lot of older adults, it can be problematic to be on your knees. So in any event, what you're going to do is you're going to find either a belt at home or a strap or a towel, and what you're going to do is you're going to place this around your neck. Now, before you actually place it in the proper position, what you're going to feel for with your hands is the bottom of your skull, and then right behind your ears, there's a couple of bony processes here, which are called the mastoid processes. And that's where you're going to be placing your particular towel or strap. And what you're going to do is you're going to place your elbows onto the table like this, and you're just going to relax your head down. You're going to relax your head down, and you're going to be basically pushing forward in this direction to stabilize your neck. Now, to create traction in this position, what you're going to do is you're going to sit your bottom back down towards your heels while simultaneously pushing forward with your hands. And you should feel a nice stretch in your neck. Do that for 7 to 10 seconds, and then come back to neutral. Wait a few moments, and then go back down into it, pushing away with your hands, trying to relax your neck as much as you can, and sitting your bottom back towards your heels. Hold for 7 to 10 seconds, and then come back up. I would recommend doing this for 3 to 5 minutes, just as much as you can tolerate, but it should feel really good on your neck. Today I've introduced 3 different concepts and exercises that you can implement at home to manage any type of nerve impingement in your neck. I hope today's episode was useful. If you have any questions, go ahead and reach out to me on PhysioEd. I'll be happy to answer any questions you might have. Thank you, and have a great rest of your day.